In this video, we will review the bones of the vertebral column, including the 7 cervical, 12 thoracic, and 5 lumbar vertebrae, as well as the fused vertebrae of the sacrum and coccyx. We will begin by discussing the overall shape of the spine. When observed from a lateral view, the cervical and lumbar regions are typically curved in such a way that their posterior aspect is concave. We describe these curvatures as a lordosis. A cervical and lumbar lordosis are considered to be normal, although we can describe them with the term hyper or hypo to indicate an excessive or reduced lordosis. In both the thoracic and the sacral region, the curvature is in the opposite direction, so that the posterior aspect is convex, and this is described using the term kyphosis. When observed from an anterior or posterior view, the bones of the vertebral column typically appear to be relatively straight. However, lateral curvatures or deviations are not uncommon and are described using the term scoliosis. Taking a closer look at a lateral view of the lumbar spine, we can note the basic arrangement of the vertebrae, with a massive cylindrical vertebral body and the fibrous intervertebral discs, both located anteriorly, numerous projections of bone, known as processes, located posteriorly, and nervous tissue housed in these intermediate spaces. Switching from a lateral view to a superior one allows us to observe the shape of the vertebral body as well as its relationship with the spinal cord. In life, the superior as well as the inferior aspect of each vertebral body will be covered with a cartilage disc known as the vertebral end plate. Projecting posteriorly off the body are 2 short, stout processes known as pedicles. Together, with these sheets of bone known as the lamina, they form what is called the neural arch, offering a protective surrounding to the spinal cord. Where the pedicle meets the lamina, on either side there is a projection that juts off laterally. Here and here are the projections. They are known as the transverse processes. Where the left and right lamina meet, there is another process that projects posteriorly. Here is its tip. This process is known as the spinous process. We'll change views again to note 2 additional processes, the superior and the inferior articular processes. Each articular process bears a smooth, flat surface known as a facet, where the superior articular process of one vertebrae meets with the inferior articular process of the next. Those smooth, flat surfaces form a joint known as the zygoapophyseal joint, or, far more commonly, simply as the facet joint. This is a synovial joint, meaning that it is surrounded by a joint capsule and filled with synovial fluid. Together, along with the flexible intervertebral disc, these joints allow for motion between the vertebrae. Returning to our superior view, we'll take a look at the important openings associated with the vertebrae. Here, surrounded by the pedicles, the lamina, and the posterior aspect of the vertebral body, is the vertebral foramen. This opening allows for passage of the spinal cord from one vertebrae to the next, and is often referred to collectively as the vertebral canal. From a lateral view, we can see another opening between vertebrae. This is known as the intervertebral foramen and is formed by a superior vertebral notch on the top of one vertebrae and an inferior vertebral notch on the bottom of another. Where these two meet, the opening allows for the passage of a spinal nerve. Next, we will make some observations regarding the regional characteristics of the vertebrae. This vertebrae, C5, can be used to highlight some of the characteristic features of a cervical vertebrae. As can be seen here, it has a relatively small vertebral body that is wide from side to side or in a medial-lateral direction, and relatively narrow in an anterior-posterior direction. At the edges of the body, it curves sharply upward in what are known as uncinate processes. The vertebral foramen is relatively large and triangular, and the transverse processes contain an additional foramen, known as the transverse foramen, through which the vertebral artery passes. The spinous process is relatively short and has a bifurcated tip. The facet joints have an orientation that allows for a relatively large range of motion in all directions in the cervical spine. When discussing the typical cervical vertebrae, it's important to note that C1 and C2 are considered atypical, meaning that the first two cervical vertebrae have some unique features not present at other levels. This is C1, commonly referred to as the atlas. It has an anterior arch with an anterior tubercle and a posterior arch with a posterior tubercle. However, it does not have a true vertebral body or a true vertebral spine. This is C2, commonly referred to as the axis. It has an additional process not present at other levels, known as the odontoid process or dens. The dens, along with a ligament known as the transverse ligament, forms an articulation with C1 that allows for a large range of motion and cervical rotation occurring between these two bones. Returning to our intact skeletal model, we see the vertebral artery represented here as it passes through the transverse foramen. We can also note the lack of a spinous process on C1, the atlas, and the relatively prominent spinous process on the seventh cervical vertebrae. Moving into the thoracic region, the vertebral bodies become larger and have additional facets for articulation with the ribs. The transverse processes in the thoracic region also have additional facets to articulate with the ribs, and the spinous processes slope sharply downward. The vertebral bodies in the lumbar region are relatively massive. This should not be surprising, as the primary role of the body is in weight bearing, and this region of the spine must bear the greatest load. The spinous process in this region is relatively short and stout, while the transverse process is relatively slender. Unlike the thoracic region, whose facet joints are well oriented for rotation, the facet joints in the lumbar spine are very near the sagittal plane, making them ideally suited for flexion and extension. We will conclude our tour of the vertebral column with a look at the sacrum and coccyx. The large wedge-shaped sacrum is typically composed of 5 fused vertebrae. It articulates superiorly with the 5th lumbar vertebrae, and its lateral surface, known as the auricular surface, articulates with the ilium to form the sacroiliac joint. The sacrum has foramina, or holes, both posteriorly and anteriorly, as well as a sacral canal that is continuous with the spinal canal. Its anterior edge is known as the sacral promontory. Finally, the coccyx is a small triangular bone typically formed by the fusion of 4 rudimentary vertebrae.